Good day, my name is Princess Nikki M. Valdez. I'm a first-year student nurse and for today, I will be performing shampooing hair in bed. Determine if any risks that might contraindicate shampooing. Check to see whether a physician's order is needed. Certain medical conditions may place client at risk of injury because of positioning, exposure to moisture, or manipulation of scalp. Example is total hip replacement, cervical neck injuries, open incisions, and tracheostomy. Assess patient health for dandruff and head lice. Should stop and report. Next is to explain the procedure to the patient because patient may be anxious about positioning or risk of water entering the eyes. Good day po sir, my name is Nikki po. So ako po yung nurse niyo ngayong araw. Ang gagawin po natin ngayon ay shampoo po kayo sir. So bago po tayo mag-start, i-check po muna yung scalp nyo and then yung hair nyo if may complications po. Ayos lang po ba sir? Na-check po yung scalp and hair nyo?
Ayos lang po.
Okay po. The next procedure is to bring all the necessary equipment to the patient's unit to save time and energy. Check po muna sir ha. So wala naman po kayong any leg injury,
Wala naman po.
back,
Wala po.
sa hands mo po, okay naman po.
Apo. Wala.
Okay po. Next is to place the newspaper on the floor under the pail. Place other articles on the bedside table and then protect the floor from getting wet to minimize stain when reaching for articles. So mga sir, adjust ko muna yung position nyo para po mas malapit po kayo sa pail natin.
Okay po.
Next is to move the patient's head and shoulder to the edge of the bed next to self to minimize muscle strain. Next is to place the rubber sheet over the pillow and with bath towel under the rubber sheet to protect the pillow from getting wet. Place the calipad over the pillow. Let the end extend to the pail. If calipad is not available, make an improvised. Get a larger plastic garbage bag and roll a towel into each side. Allow draining of water from the pad that is directed into the receptacle. Next is to place the hand towel around the neck of the patient and pin in front. The other hand towel should be placed over the chest of the patient to protect the patient's gown. Next is to comb the hair well before shampooing. Removing tangles result in more thorough cleansing. Next is to place the piece of cotton in the patient's ear to prevent water from entering the ear. So sir, start na po tayo. Babasahin niyo na po yung head niya.
Okay po.
washcloth and place it over the eyes of the patient to prevent solution from getting into the eyes because shampooing may be irritating. Pour warm water over the head. Wet hair thoroughly. Shampoo applied to hair that is not thoroughly wet make it sticky and does not rinse easily. Water aids in distribution of shampoo over the hair. Make lather with shampoo, start at hairline and work toward back of the neck. Lift head slightly with one hand and wash back of head. Shampoo side of the head. Massage scalp by applying pressure with fingertips using finger pads. Systematic progression over hair and the scalp. Next is to rinse hair thoroughly. Retain shampoo leaves dull finish on hair. Dried shampoo may cause scalp irritation. Next is to apply conditioner to hair if patient desires. Conditioner prevent excess drying. Dry face with towel used to protect eyes. Dry off moisture along neck and shoulders. Retained moisture may cause cooling and chilling. Next is to use a dry towel, pat hair dry and wrap turban style. Prevent dripping from wet hair. Next is to remove cotton from ears and discard. Dry ears, forehead, and neck. Comfort of patient. Next is to rub the hair and scalp with bath towel until dry. Comb the hair to remove tangles. Drying prevents chilling. Next is to inspect condition of hair. Shampooing should leave hair in a clean condition. Okay na po sir, nice and clean na po yung hair and scalp nyo. Thank you po. And the last procedure in shampooing is to record the procedure and pertinent findings related to condition of hair scalp. Documents patient respond to therapy and conditions of hair or scalp should further treatment to be necessary.